Hi, I'm Dr. Janine Johnson. I'm a chiropractic physician. I've been in clinical practice for 24 years, and I'm here today to talk to you about dizziness and vertigo. There's two types of vertigo. One called egocentric or subjective, and that's where the person feels themselves spinning. The other is called geocentric or objective, and that's where the room is spinning. Sometimes I have patients come in, they'll say, geez, I'm lightheaded, I think I have vertigo. Well, lightheadedness is not vertigo, though that is something that needs to be addressed. The other thing that you may be suffering from is called Meniere's disease, and that's where you have a decrease or loss of hearing, you may have dizziness, ringing, buzzing, a fullness in the ear. That's where the temporal lobe, that's a part of your brain, the temporal lobe is overfiring and usually on the right side. People that have dizziness, vertigo, well, some of the symptoms they have, we have visual depth perception problems, light sensitivity, headaches, decreased memory, because memory lives in the temporal lobe. Many times you might see an MD for dizziness and they'll tell you, well, it's an inner ear problem, or it's what they call BPPV, or benign proximal positional vertigo. The theory is that there's calcium crystals that fall off the hair cells and cause this dizziness. The reason I say theory, because medically we're not sure if that's exactly what happens, but that's what they think happens. Dizziness can be caused from a lot of things: stroke, high blood pressure, a tumor. So I'm not talking about that kind of dizziness. And if you do have dizziness or vertigo, you need to make sure that you do have a medical neurological evaluation to rule out those things. I'm talking about once they've done that and you're still having it, that's when you need to come see me. Many times medically, they treat dizziness with a medication or prescription drug called meclizine or antivert. And that does work for some people, but it doesn't work for a lot of people, and they're the ones that end up in my office. So some things that you may have had done, I may also do in my office, is what's called a Dix Hall Pike maneuver or test. That's where we rock you back and we look to see if there's nystagmus of your eyes, abnormal movement of your eyes. We may also do what's called Epley's maneuver. MDs and physical therapists will do this as well, but it's important that it's done only on one side, on the correct side. You should not do it bilaterally on both sides. That helps to move those crystals. It also can help if you have BPPV. Now there's two causes to dizziness aside from anything pathological. Two causes: problem in the semicircular canals or problem with the cerebellum. Now cerebellum has a right and left side. There's also three parts to cerebellum. There's the anterior, the posterior, and the floccular nodular lobe. When you don't have proper firing in the cerebellum, it can cause this dizziness or vertigo. Another thing, that the reason why people get nauseous or they vomit when they have dizziness, vertigo, is because there's an overfiring in the upper brain stem. And in the upper brain stem is something called the nucleus tractus solitarius. And that's where your cranial nerve number 10 lives. It goes into the gut. So if there's overfiring, overstimulation of that, you're going to feel sick and you're going to probably vomit. So what do I do to help? I use what's called functional neurology. I'm going to assess your brain function without the use of needles and MRI. I can assess how your brain's functioning and where there may be deficits. And then I'm going to treat you by utilizing what's called brain-based therapies. We're going to use unilateral adjusting. That means adjusting you only on one side. Because you probably have heard that the right side controls the left side of the brain and the body, and the left controls the right. And that's true. We're going to find out where you need to be adjusted, or where the part of the brain needs to be fired, and then we're going to adjust you in such a way to get that brain to fire the way it should. We may use caloric, a warm caloric in the air. Cold caloric helps us to diagnose the vertigo, and a warm caloric can help correct the problem. The water bounces off the eardrum, it comes back to the cup, fires off the vestibular nerve, fires off the cerebellum. We're going to do eye exercises. Certain movements of the eyes, once we find out where your deficits are, can get the brain to fire better. We're going to do auditory stimulation. Certain sounds in your ears can stimulate the brain. Visual stimulation. Sometimes even just having a person imagine doing something can stimulate the brain and correct a problem. Now you may see on the internet, take this herb or that supplement, or that amino acid to fix your dizziness or vertigo. And I can tell you in 24 years of practice, there is no amino acid, no herb that's going to fix your dizziness or vertigo. Yes, you do need vitamins, you need good nutrition. We recommend and we prescribe that to our patients as well. But that alone is not going to fix your problem. You have to incorporate the neurological piece to correct this problem. We also will incorporate metabolic testing. That's where we're going to look at your biochemistry. We're going to do complete blood work, a complete metabolic panel, a CBC with autodifferential, a complete thyroid panel, a complete lipid panel. We're going to look at how all your organs function. We're going to look at your cortisol levels, your adrenals, how your adrenals are functioning. Adrenal stress test tells us about the cortisol levels and the DHEA. You should wake up in the morning, be ready to go, and then at night, ready to go to bed. And that doesn't happen for people with these types of problems. We can check you for any kind of food sensitivity, gluten, egg, soy, yeast, milk, and other foods to really pinpoint where your problems are coming from. Because we don't realize how foods, how that can flame up or inflame our whole body and our brain function. Check you for bacteria, yeast, fungus, parasites, H. pylori, even your male and female hormones. All these things, comprehensive testing, stuff that just hasn't been even considered before. Now, at this point in time, most people are asking themselves, wow, this sounds great. I wonder if my insurance is going to cover this. I can tell you this. I don't know. I don't know what you need. I don't know what your insurance will cover. I can tell you this. Your insurance will cover very little to none of what I do for most people. So if your receiving care is based on your insurance paying for most or all of what I do, then I'm sorry, I won't be able to help you. But if you're really ready to get some help, I can tell you that the people that truly want help, can afford it, because we have ways of doing that to help them get the care that they need. Many times people with dizziness problems I had one patient that had Tom. He'd been to Mayo Clinic twice, he'd been to U of M. They told him it was old age. And his thinking was, well, if it was just old age, all my friends would be suffering from this problem. Came to my office. We've been able to help him resolve his dizziness problem. So if you're to the point where you're tired of doing the same thing over and over again, you're tired, it's really hard to live with a dizziness or vertigo problem long term. If you're one of those people, you're ready to take charge of your health, please feel free to give me a call. I'm here to help you. What I do works. My number is 231-882-5533. Call and schedule your consultation. You can also check us out on our website, www.crystal, C-R-Y-S-T-A-L, lakechiro.com. I'm also on YouTube. You can check out some of my videos there. Just type in my name, Dr.Janine, J-A-N-I-N-E, Johnson, J-O-H-N-S-O-N. My videos should come up. And when you call, be sure to ask for a copy of my book. It's called Solving the Mystery of Your Chronic Condition. I really look forward to seeing you in my office. I'm Dr. Janine Johnson. Thank you.